Hello and welcome. Today we're diving into a rare but serious condition called Danon disease. This genetic disorder primarily affects the heart and muscles, leading to significant health challenges. We'll explore its causes, symptoms, diagnosis, and management to better understand this complex condition. Danon disease is caused by mutations in the LAMP2 gene. This gene provides instructions for making a protein called lysosome, associated membrane protein 2, or LAMP2. LAMP2 is crucial for the proper function of lysosomes, which act as the cell's recycling centers, breaking down waste products. When the LAMP2 gene is mutated, lysosomes can't function correctly, leading to an accumulation of cellular debris, particularly in heart and muscle cells. The buildup of cellular waste, especially glycogen and autophagosomes, within heart cells or cardiomyocytes, causes significant damage. This accumulation disrupts the normal structure and function of the heart muscle, leading to hypertrophic cardiomyopathy, where the heart muscle thickens, or dilated cardiomyopathy, where the heart chambers enlarge and weaken. Similar accumulation in skeletal muscle leads to muscle weakness and impaired function. The abnormal glycogen accumulation also affects the electrical conduction system of the heart, potentially causing life-threatening arrhythmias. Danon disease is a very rare condition. Because it is a genetic disorder, it is present from birth, though symptoms may not appear until later in childhood or adulthood. It affects males more severely than females due to its X-linked inheritance pattern. The exact prevalence is difficult to determine because of its rarity and potential for misdiagnosis. The signs and symptoms of Danon disease can vary, but often include progressive muscle weakness, intellectual disability, and characteristic heart problems. Heart-related symptoms include shortness of breath, chest pain, fatigue, palpitations, and fainting. Muscle weakness can lead to difficulty walking, running, and performing everyday tasks. Some individuals also experience visual impairments due to retinal abnormalities. The severity and onset of symptoms can differ greatly between individuals, even within the same family. Diagnosing Danon disease involves a combination of clinical evaluation, genetic testing, and specialized diagnostic procedures. A physical examination and review of symptoms are the first steps. An electrocardiogram, or ECG, and echocardiogram are used to assess the heart's electrical activity and structure. Muscle biopsies can reveal the characteristic accumulation of glycogen and other cellular debris. Genetic testing to identify mutations in the LAMP2 gene confirms the diagnosis. While there aren't distinct subtypes of Danon disease in the traditional sense, the presentation and severity can vary significantly. Some individuals may primarily experience cardiac symptoms, while others may have more pronounced muscle weakness or intellectual disability. This variability is likely due to differences in the specific LAMP2 mutation and other genetic and environmental factors. Currently, there is no cure for Danon disease, and treatment focuses on managing symptoms and preventing complications. Medications can help control heart failure and arrhythmias. Physical therapy can improve muscle strength and function. In severe cases, a heart transplant may be necessary to prolong life. Implantable cardioverter defibrillators, or ICDs, are often used to prevent sudden cardiac death. As a genetic disorder, Danon disease cannot be prevented in the traditional sense. However, genetic counseling is crucial for families with a history of the condition. Carrier testing can identify individuals who carry the mutated gene and inform reproductive decisions. Prenatal testing can also be performed to determine if a fetus has inherited the condition. The prognosis for individuals with Danon disease is generally poor. The disease typically progresses, leading to significant disability and reduced life expectancy. Heart failure and sudden cardiac death are major concerns. However, with advances in medical management and potential future therapies, there is hope for improving the quality of life and longevity for those affected. Recent research is exploring gene therapy approaches to correct the underlying genetic defect, offering a potential future cure. Clinical trials are ongoing to evaluate the safety and efficacy of these novel therapies.